Hi, hello, welcome to my YouTube channel, All Nursing MCQ. Identify the diagnostic technique shown in photograph. Options are ERCP, endoscopic retrograde cholangiopancreatography. Option B, MRCP, magnetic resonance cholangiopancreatography. Option C, colonoscopy. Option D, sigmoid colonoscopy. Answer is option A, ERCP. Severe generalized edema is called. Options are mixed edema, pitting edema, anasarca, dependent edema. Answer is option C, anasarca. So when edema is massive and generalized, it is called anasarca. It is caused by a variety of clinical conditions like heart failure, renal failure, liver failure, or problems with lymphatic system. Which of the following is a substance that decreases pain transmission and causes an inflammatory response? Options are substance P, endorphin, prostaglandin, histamine. So the answer is option B, endorphin. An opening of surgical wound edges is called. Options are wound eversation, wound rupture, wound approximation, wound dehiscence. So the answer is option D, wound dehiscence. Which of the following is a manifestation of pyloric stenosis? Options are projectile vomiting, regurgitation, steatoria, tenesmus. Answer is option A, projectile vomiting. Use of epinephrine will cause which of the following symptoms? Options are bradycardia, tachycardia, increased BP, tachypnea. So the answer is option B, tachycardia. The confirmatory test for the diagnosis of multiple myeloma is options are bone marrow biopsy, differential count of WBC, serum calcium, PET. So the answer is option A, bone marrow biopsy. Blood test, urine test, X-ray, PT, PET, CT scan are useful in diagnosis of multiple myeloma, but definitive confirmation of multiple myeloma can be made only through a bone marrow biopsy. Iron chelating agent is options are charcoal, deferoxamine, calcium gluconate, alum. So the answer is option B, deferoxamine. Patient complaint of pain and has redness with swelling at the site of IV. The nurse must. Options are stop infusion and remove IV cannula, start nasal oxygen, change IV tubing and the solution, apply warm moist pack to the reddened area. So the answer is stop infusion and remove IV cannula. Identify the valvular condition shown in the photograph. Option A, mitral regurgitation, aortic regurgitation, mitral stenosis, aortic stenosis. So the answer is option A, mitral regurgitation. Which part of the body is affected in typhoid? Options are lungs, intestines, liver, pancreas. So the answer is intestines. Extra calories needed during second trimester of pregnancy is 300 kilocalorie per day, 500 kilocalorie per day, 600 kilocalorie per day, 700 kilocalorie per day. So the answer is option A, 300 kilocalorie per day. After the birth of the baby, foramen ovale closes and it became. Options are ligamentum venosum, ductus arteriosus, ductus venosus, fossa ovalis. So the answer is option D, fossa ovalis. The best investigation to diagnose anencephaly at 12 weeks of pregnancy is. Options are X-ray, amniocentesis, ultrasonography, serum AFP. AFP mean alpha fetoprotein. So the answer is option C, ultrasonography. Which of the following positions should the nurse place the client when the epidural regional block is administered? Options are lithotomy, supine, prone, lateral. So the answer is option D, lateral position. Sensory loss shown in photograph indicate palsy of. That sensory loss is shown in the picture as a shaded area. So the options are radial nerve, ulnar nerve, median nerve, axillary nerve. So the answer is option A, radial nerve. Complete dilation of cervix to birth of a baby is staged as stage 1 of labor, stage 2 of labor, stage 3 of labor, stage 4 of labor. So the answer is stage 2 of labor. Number of teeth in a 3-year-old child is. Options are 20 temporary teeth, 25 temporary teeth, 12 temporary teeth, 16 temporary teeth. So the answer is 20 temporary teeth. The infant's weight becomes triple from birth weight in. Options are 6 months, 1 year, 2 year, 3 year. So the answer is option B, 1 year. Which of the following is not a component of Apgar score? Options are color of the body, muscle tone, heart rate per minute, respiratory rate per minute. So the answer is option D, respiratory rate per minute. In a child with lactose intolerance and absent lactase activity, which of the following food is least likely to cause symptoms? Options are ice cream, skimmed milk, condensed milk, yogurt. So the answer is option D, yogurt. Which of the following type of research involves high researcher control, random sampling, and laboratory setting? Options are cohort study, case control study, true experimental, quasi experimental. So the answer is option C, through experimental. Applied research seeks to solve a clinical problem in options are natural setting, laboratory setting, controlled setting, simulated setting. So the answer is option A, natural setting. Which of the following is the contraindication of gastric aspiration from NG2? Options are hypertension, diabetes, esophageal varices, severe dehydration. So the answer is option C, esophageal varices. Which condition is caused by the deficiency of vitamin D in children? Options are rickets, osteomalacia, muscular dystrophy, hemolysis. So the answer is rickets. Thanks for watching. Please subscribe our channel.